postnatal depletion is a syndrome of symptoms and signs that can occur after the birth of a child. It can be quite normal for mothers to feel tired, have some mental stress and emotional problems in the early time after children, but it's not normal for that to occur for many months or even years afterwards. So postnatal depletion is this exaggerated situation where mothers feel extremely tired, both mentally and physically. They can have a lot of physical issues, and those physical issues include allergies, autoimmune problems, and gut health problems. And it can include a lot of symptoms like anxiety, depressed mood, even though postnatal depression is something quite different, and poor concentration, memory, and essentially a feeling like a mother's not going to recover her health again. And postnatal depletion can occur for months and years after the birth of a child. And whilst that may be common, that's not, in my belief, a normal thing to be happening after the birth of a child. A big part of postnatal recovery ideally occurs in the 4th trimester. Everyone knows that the first 3 trimesters, no one's really thinking about a postnatal plan or the best way to recover. And so many people are talking about the 100 days after the birth of a baby or the 4th trimester. And if you have a look at a lot of old cultures, they have very complex plans of making sure mothers are able to recuperate from the ordeals of having a baby and the sleep deprivation that goes along with that. And I believe that those old cultures understood how important it is for a mother to have deep rest, especially in that first 6 weeks, and to be having foods that are easily digestible. So part of the plan with postnatal recovery, and it doesn't have to happen in that first 100 days, is about making sure a mother is able to have optimal sleep. That's the #1 thing for postnatal recovery. It's not a straightforward thing. And then about how to optimize her nutrition, manage her stress levels, because a mother's life is very busy and she needs to learn how to manage her stress. And then about what supplements, in terms of helping with micronutrients, iron, zinc, are 2 of the most important, but there are many more. Supplements like DHA from fish oil, very important in the recovery for mothers, and other supplements that can be useful in helping speed up that recovery process. We live in a world where there is a lot of pressure on mothers to be super mums, that they have to be doing it all, that they don't need help. And when we look at the world of social media, we see a lot of these perfect mums. And so a very common thing that I see is mothers have very poor self-esteem as a result. They're tired, they don't feel good about themselves, and they feel that they're doing a poor job as a mother. So in terms of helping self-esteem, I think helping to improve energy is very important, to be able to have time to be able to recuperate the nervous system in terms of managing stress, and having relaxation can be super important, and prioritizing. So that's a big thing, that mothers need permission to be able to say, look, it's okay to be looking after myself as well as my children. It's about prioritizing self-care and having help with doing that. And so gradually a mother's self-esteem can improve through those things.